Surgical patients that are admitted to Memorial Hospital are typically admitted to inpatient units that are designed for management of patients with specific diseases. So for example, we have a women's oncology unit that manages patients who have had breast cancer, GYN cancer. The surgeons that operate on those particular diseases are admitted to that specific unit. The nice thing about it and what makes us different at Memorial is the nurses, the pharmacists, social workers, the ancillary staff, the case managers, all of the team that manage those patients are experts in that particular disease. So for example, if a man comes in for prostate surgery, he will go to our unit where all the patients on that floor have that particular disease and treatments. The nurses' expertise on our disease management teams starts when the nurse is hired here. We hire bachelor's prepared nurses, and that's a minimum requirement. Of course, they have to be licensed as registered nurses. And then we put them through an extensive orientation program specific to the disease that they're going to care for. Each unit has a clinical nurse specialist for that particular disease management team. That clinical nurse specialist is a master's prepared nurse who also is an expert in that disease team. That is what I like to call them the faculty of that unit. So that person, that nurse is available to all the other staff on the floor, the physicians, training physicians such as our fellows and residents, as well as our nursing staff, to be able to teach them the standards of care and the standards of practice for how to manage patients with those particular diseases. Here at Memorial, additional nursing roles that we have, in addition to the clinical nurse specialist, for example, would be our nurse practitioners. These are also master's prepared nurses that have special certification so that they can function in a role in partnership with our physicians where they can prescribe, they can order medications, treatments, diagnostic tests. They can assist the physicians in discharging the patients to home by ordering equipment the patient may need at home or medications. So they are nurses by background, but they have that additional licensing and certification where they can order and prescribe medications and treatments. What makes that unique is each of our surgical services here inpatient at Memorial have nurse practitioners. So while our physicians may be in the operating room or they may be in clinics seeing our patients that are outpatient, these nurses reside on the unit working with our patients, families, and the staff on the unit to ensure that their care is correct, timely, their transition to home is done correctly, they have all the right medications they need, and that role has really been pivotal in improving care at Memorial.